Welcome to Open Enrollment 2019 for Twist's Benefit Plans. This is your annual opportunity to review your benefit options and make changes if needed. A lot can happen in a year, and maybe your benefits are no longer the right match for you and your family's needs. For our agenda today, we will review open enrollment details, provide an overview of your benefit programs, and look at some of the vendor resources available to you. During open enrollment, you can make changes to your benefit elections like switching plans, changing coverage levels, or adding and dropping dependents from coverage for all of these plans. In the upcoming weeks, your benefits should become a big priority. That's because open enrollment only happens one time a year, and it's the only time you will be able to make changes to your benefits. During the open enrollment period, you can make changes to your benefits elections as many times as you want, but the last change you submit before the end of open enrollment will be the benefits elections you will keep for the next plan year. Open enrollment officially starts on Monday, November 5th, and ends Monday, November 26th. Your benefit elections will be effective January 1st, 2019. Before we go into the benefit plans, let's take a quick look at who is eligible for benefits and when those benefits become effective. If you are a full-time employee working 30 hours or more per week, you are eligible for Twist's benefit plans. For new employees, if you enroll in the medical, dental, vision, and/or FSA plans, your coverage will be effective your date of hire. Your eligible dependents are your legal spouse or domestic partner and your dependent children to age 26. What do you need to do? Mark your calendar, review your plans and elections, sign in to your benefit enrollment site, and make your changes. Remember to finalize and confirm your elections. We encourage you to review your personal information and your life insurance beneficiary for the correct designation. If you don't actively enroll in benefits during open enrollment, you'll be automatically rolled over to the same plans for the upcoming year. That won't happen, however, if you're using a flexible spending account. If you want to use an FSA account for next year, you'll need to re-enroll in that plan during open enrollment. If you miss open enrollment, you will not be able to make changes to your benefits until the next open enrollment. Outside of open enrollment, you can only make a change if you experience a qualifying event, such as an adoption or birth of a child, marriage, or spouse's change in employment. If you do experience a qualified family status change, you need to request any changes to your elections within 30 days of the event. Let us dive into the benefits program. Following is the listing of your 2019 benefits that we will be reviewing. You will notice that there are no change of carriers. However, carriers make minor changes to their plans, and therefore, we always advise that you read the summary plan descriptions. Here are the 2019 monthly contributions. Please note they will be effective 1/1/2019 to 12/31/2019 and are deducted on a pre-tax basis. If you are enrolling a domestic partner, deductions for their portion of premium will be post-tax and imputed income will apply. If you have other medical coverage, you can decline medical coverage through Twist. You will receive a $300 monthly credit for declining coverage. That amount will be deposited into your paycheck as taxable income. To receive the credit, you must certify that you and your family have other coverage and elect the credit. Twists offers Kaiser and Blue Shield HMO, available only in California. Blue Shield and Kaiser both have an HDHP PPO plan. and Blue Shield also has a traditional PPO. We are consolidating the PPO options on Blue Shield due to enrollment. We are maintaining the PPO plan that most were enrolled in. You may be familiar with the Kaiser and Blue Shield HMO, which offers benefits through their network providers only. Blue Shield PPO provides more flexibility than the HMO plans, with access to both network and non-network providers. Within the PPO environment, utilizing in-network providers will result in the highest benefit and lower costs. HMO plans have no annual deductible, and once you have met the out-of-pocket maximum listed above for you and your family, then the plans pay for services at 100%. Your office copay for this plan is $20. There is no charge for preventive care. Outpatient surgery copay is $100 to $150 per procedure, and inpatient hospital copay is $250 per admission. An emergency visit, if not admitted, is $50 to $150 per visit, and prescriptions are $10 for generic and $25 to $30 brand formula, and on Blue Shield, $40 copay for non-formulary. Tier 4 prescription, i.e. injectables, will have separate copays. Remember, with HMOs, services received outside of the HMO network are not covered. The only exception would be for emergency services. If you are traveling and have a life or limb-threatening emergency, go to the nearest emergency room. Do remember there are many preventive prescriptions which are at no cost to you. For a list of these medications, visit your online account with Blue Shield. Please reference the SBCs if you would like more details about your plans. These can be found within ADP. PPO plans provide more flexibility as you can access both in-network and non-network providers. When you stay in-network, your costs are lower. For office visits and prescription drugs, you pay the above-listed copays. Blue Shield has also negotiated contracted rates with the in-network providers for the other more expensive services, such as inpatient hospitalization and surgery, in which deductible and coinsurance apply. The PPO plan also protects you with a maximum out-of-pocket limit of $2,250 per individual when you stay in-network. All your expenses in the calendar year, including copays, deductible, and coinsurance, will not exceed this amount when you stay in-network. Acupuncture and chiropractic care are covered in-network with a $25 copay per visit, up to 20 visits per year. When you go out of the network, your out-of-pocket costs will be much greater. Typically, you will spend 30% after the deductible for medical care. This is against a Medicare reimbursement level of 110%. Should the charge be higher than the allowed amount, you can be balanced billed. Full listing of details are housed on ADP. Diving into HDHP, high deductible health plans, and health savings accounts. You will see that the high deductible health plan does not really denote a super high deductible. If you are an employee only enrolling in this plan, then your calendar year deductible for medical and pharmacy in-network services is $1,500. If enrolling dependents, then the dependent maximum is $3,500 in-network. Focus on the out-of-pocket maximum. This is the most you will pay for service in any given year. While the deductible is higher on the HDHP plan, there are two major advantages to participating on this plan. The first is that your monthly premiums are lower if you are covering your dependents. The second advantage is that you have a health savings account. Your HSA can be a tax-advantaged savings vehicle for retirement, or you can use your HSA account to reimburse your healthcare expenses such as your deductible, co-pays, and co-insurance on a pre-tax basis. Twist will fund your HSA account up to the federal limit on a prorated basis. The PPO and the HDHP plan use the same network, and both cover preventive care at 100% in-network. Other services after the deductible will be paid in-network by Blue Shield and Kaiser at 90%. You might ask yourself, how does this make sense? HDHP plans insured members have more control and flexibility of how they want to receive their health care. They can take advantage of a health savings account and use these funds for dental and vision expenses in addition to medical. What is a health savings account and who is eligible? A health savings account, or HSA for short, is your personal bank account that you can set aside money to pay for your healthcare services and qualified medical expenses. Because of the tax-favored status of the HSA, you must meet the eligibility requirements. You must be covered by a qualified high-deductible health plan, or HDHP. You cannot be enrolled in a general-purpose FSA with twists or through your spouse's employer. You also cannot be enrolled in Medicare or be claimed as a dependent on your spouse's tax return. Twists also contributes to your HSA. For 2019, Twists will fund the full maximum of $3,500 per year for employee-only coverage and $7,000 per year for family coverage. These funds will be prorated over the pay periods. If you are 55 and up, you can contribute the catch-up of $1,000, and if you have a spouse 55 and up, they can open their own HSA and contribute their catch-up of $1,000. The HSA provides 3 tiers of federal tax savings: pre-tax contributions, tax-free earnings, and tax-free distributions. No other investment vehicle with so many tax advantages. The HSA funds you never lose. They will roll over from year to year until you need to use them. You can also invest your funds once you have more than $2,000 in your account. Processing claims is just like any other plan. Visit in-network facilities, present your ID card, let the claim adjudicate, and use your HSA debit card to pay your portion. Prescriptions processed the same way. Remember to always look for discounts or coupons on GoodRx. Blue Shield telemedicine is an easy and convenient way to save money. This is available on Blue Shield PPO plans for a $5 copay. Download this tool now, and then when you have a medical issue, you are ready to roll. Why go to the ER or urgent care when you can simply Skype a doctor? Avoid long lines and catching other people's germs. Kaiser also has the ability to email and/or Skype a doctor. Blue Shield members have access to the Wellvolution program. This is wellness your way. Every one of us holds the power to prevent and even reverse negative health outcomes. With Wellvolution, you receive the personalized support you need to make healthy decisions. Kaiser offers many wellness benefits and coaching. Please dig deeper online. Twists is pleased to offer dental benefits through MetLife. Twist offers a very competitive dental plan with a maximum benefit of $2,500 per insured member. The orthodontia is for both children up to age 26 and adults. Do remember you can use your HSA funds for dental expenses. Out-of-network services are based on a percentage of the reasonable and customary charge. An out-of-network dentist may charge higher than this charge, and in this case, you will be responsible for paying any difference between the dentist's fee and MetLife's payment. It is always advised to receive a pre-authorization. This will allow you to negotiate prior to the work being done and make you aware of the cost. VSP provides our vision coverage through MetLife. It is easy to find a contracted provider which will cover you for an exam every 12 months for a copay of $10. If you need materials, you will pay a copay of $10, which will provide you with lenses and a frame allowance of up to $150. If you prefer contacts in lieu of glasses, you are covered for the same allowance of $150. If you receive frames from Costco, the allowance is reduced from $140 to $85. For special offers, please visit vsp.com/special offers. Twist provides a basic life and AD&D benefit of 3 times annual salary to a maximum of $500,000 at no cost to you. Remember to double-check your listed beneficiaries as part of this open enrollment period to ensure that they are up to date. You have the option to elect up to $500,000 in voluntary life for yourself, $100,000 for your spouse, and $10,000 for your dependent children. You will need to complete an evidence of insurability form if you are electing this benefit during open enrollment or increasing your current elections. Voluntary AD&D will be the same election amounts as voluntary life. Again, remember to double-check your listed beneficiaries as part of this open enrollment period to ensure that they are up to date. Disability is an important benefit that provides salary continuation if you experience a short or long-term disability. Twist covers you 100% for these benefits. For short-term disability, you are covered after 7 days and will receive a benefit of 60% to a max of $2,308 per week. Short-term disability is integrated with all sources of income, including Social Security and state disability programs. If your disability continues for longer than 180 days, you will be eligible to continue salary continuation under long-term disability, which provides a benefit of 66.67% up to a max of $15,000 per month. In the event of a total disability, LTD will provide a benefit to you until your normal retirement age. We hope you never need it, but Twist offers you the option to purchase critical illness insurance for you and your dependents. You have the option to purchase a $15,000 or a $30,000 benefit for you and your dependents. This amount is guaranteed issue if you enroll as a new hire or during this year's open enrollment. In most states, there will be pre-existing coverage limitations. Please see the summary of benefits for more details. Our flexible spending and commuter benefits are administered by PlanSource. The annual maximums are listed above. If you are enrolled in the HDHP HSA plan, then you can enroll in the Limited Purpose FSA account. This will limit your expenses to dental and vision only. Transit and parking benefits are available. However, if Twist pays for parking in some locations, and therefore there is no need to sign up unless you take public transit and pay for parking to park in the public lot. The FSA plans allow you to set aside money on a pre-tax basis for reimbursement on eligible out-of-pocket expenses you incur in the 2019 calendar year. The Healthcare FSA is for healthcare expenses for you and your dependents, such as copays, deductibles, dental expenses, and/or vision expenses. The Dependent Care Account reimburses you for daycare expenses that allow you and your spouse to work full-time. Our plan does allow for you to carry forward up to $500 of unused healthcare dollars into the following plan year if you have a positive balance following December 31st. Unspent dependent care or any amounts above $500 for healthcare will be forfeited per IRS requirements. If you are a current participant in the FSA, this is a good reminder to check your balances and make sure you can spend it before the end of the year. This slide lists some eligible healthcare expenses. The $2,700 IRS annual limit is per employer. You can also find a full listing on fsastore.com. This slide covers eligible dependent care expenses. It is important to note that both you and your spouse must be working full-time or full-time students to qualify for participating in this plan. $5,000 is the IRS annual limit per family, so only you or your spouse should enroll to this maximum. MetLife is your EAP offering. You have unlimited telephonic counseling and up to 3 face-to-face visits per family member per year with a licensed professional. The EAP is available to assist with a variety of life issues, from family care, legal, and financial issues. The EAP is completely confidential. Download the Strive mobile app to have all your benefit information at your fingertips. We are here to help. Twist's employees have a dedicated helpline all year long. If you have questions, please reach out. Remember, log into ADP Workforce now to review your options and make your 2019 elections by November 26th. Take time to log into your carrier's website and download their mobile app. The carriers have many resources that you and your family can benefit from. Takes just a few minutes, however, you can be on the road to better health. Thank you. Vendor resources to follow.